Hmm. For whatever reason, my Instagram is definitely not working. Okay, we'll go live. Alright, how's everyone doing? Today we're going to talk more about the digestive system. Maybe some of you are here for the first time. I'm just going to go from beginning to end and teach you guys how I fix my constipation problem. I'm going to also share with you some other educational information. Instead of talking about the solution right away, we want to also learn about some practical pessimism. People, they have a lot of health problems, and we don't want to wait until the problem is so severe we don't know how to fix it. Most people wait until the problem is way too severe. And hopefully this presentation will be very helpful for you. If you want to put any questions during this presentation, just put them in the comments. Every once in a while, I'm going to swing through all my social media to see if there are any specific questions that can help answer. So a couple of things. When we're looking at chronic constipation, you need to first understand how your digestive system works. Oftentimes we look at this photo, this picture from human physiology, and it can be very intimidating because we don't know what we're looking at. I didn't know what I was looking at. I never studied this. I don't have a medical background. None of this professional medical advice, diagnostic treatment. If you're dealing with any medical condition, dealing with anything with your health, you need to seek your healthcare provider. Now, looking at this photo, I'm just going to break it down for you. Food enters your mouth, down the esophagus, into your stomach. Now over here, you have your digestive enzymes start to break down the food. And over time, food is going to enter your small intestines next, and followed by your large intestines over here, and out the back for elimination. That's it. There are many other components. In the future, I'll discuss how your liver and gallbladder works, how it works with your pancreas, okay? But right now, let's just focus on this pipe work. Into the stomach, food you eat enter your stomach. Over here is going to gradually work its way into the small intestine. The small intestine is 4.5 meters, or roughly 15 feet. Then that food is going to enter into your large intestine, gradually work its way up the ascending portion of your colon. This is transverse. And finally the descending portion of your colon. And finally out the back for elimination. The large intestine is 1.5 meters in length. A much easier picture for us to look at this would be this one. When we're dealing with chronic constipation, there's some type of obstruction that is taking place within this pipework. Once again, food enters your mouth, down the esophagus, into your stomach. Digestive enzymes start to break down the food. Food enters your small intestines next. 4.5 meters, followed by large intestine, 1.5 meters, and out the back for elimination or defecation. Now, if you're taking notes, I want you to write down a few simple things. What you eat through your mouth must exit out of the back as elimination. When we cannot perform this basic function, we're going to have many problems. And give you guys a little bit of an idea, just how long is 4.5 meters combined with the large intestine, 1.5 meters. So you got 6 meters total, right? So taking a quick look at this NBA basketball rim, from the floor to the basketball rim, it's roughly 3 meters or 10 feet. That's it. The combined length of your small and large intestines is equal to 2 of those. Just imagine down here, you're looking at this basketball rim, and you gotta put another one on top of another, 20 feet, roughly 6 meters, and that's the combined length of your small and large intestines. When we can break down human physiology in these simple terms, we begin to understand what we're actually dealing with. Chronic constipation, many people are very familiar with this problem because we all at some point had this struggle. You're sitting on the toilet, you're popping veins in your temple, you're huffing and puffing, begging and pleading, you're making deals with the Almighty, But at the end of that, all that huffing and puffing, this is what you get. A little bullshit sheep pebble. Now, chronic constipation is a worldwide problem. I took a quick look at the search volume on Google Trends. Doesn't matter if you're searching for this keyword in the English language, Turkish, Russian, Chinese, Korean, Portuguese, Tajik, Arabic, I don't care. Everyone is searching for this keyword constipation, and it's always trending up. It has never contracted over the last 20 plus years. That's because of could be a lot due to our nutrition, could be a lot of different factors, which I'll discuss today. When elimination is incomplete, residues of all feces can build up in layers on the walls of the colon. As they putrefy, they can cause health problems, pain, and discomfort. Okay? Putrefy simply means decay and rot, and most people have these problems. I've certainly had these problems over the years. I think throughout my late 20s and also 30s, I had chronic constipation. How do I define chronic constipation? If I wasn't going to the bathroom, bowel movements, every single day of the week, I'm chronically constipated. Somebody says that, well, I'm 2 days chronically constipated, or 3 days, I only go once every 3 to 4 days, and they think that is very normal. From a 2 to 3 day chronic constipation, we'll push into a 3 to 4 day, and then 4 to 5 days. Some people, they can go a whole weekend without going to the bathroom one time, talking about bowel movements, and they think that, oh, this is how my body works, Well, this presentation is going to give you a lot of practical pessimism. I want you guys to realize that when we don't get that waste material out of the body, what could potentially happen? Let's talk about some of these problems. Toxic megacolon. So you've been eating this whole time, and I've been telling you, now the waste material that comes out is a 1-to-1 ratio. Most people, they are having that hardened fecal matter over time. So not all of their waste material is exiting out of the body. We need to go from the picture on the left to the picture on the right. That's how we start to recover our health, to eliminate chronic constipation, restoring our bowel movements. Now, toxic megacolon, this is completely inflamed in the colon. Now, the picture on this right, we're looking at, this is not Animal Planet. This is a colon that extracted out of a patient. Toxic megacolon is a life-threatening complication of inflammatory bowel diseases. These diseases can be painful and cause permanent damage to the large and small intestines. IBDs include ulcerative colitis, Crohn's disease, and infections caused by this other colitis. Toxic megacolon is characterized by swelling and dilation of large intestine due to the inflammation and accumulation of large amount of gas. I'm going to just share with you right now, it's going to be a lot more than just gas. It's going to be hardened fecal matter, unresolved, and it's this hardening that over time, that's what produces this toxic megacolon. Now, when they remove the colon like this, you wonder, well, what did they do next? There are many other complicated surgical procedures which I'll talk about right now. Now, let's come back to this picture. This is your colon, the ascending portion, transverse, and then descending portion, and out the back for elimination. Now, some people, they're just so severe, they have to remove the whole colon. Now, some people, they might just have a portion of their colon that is messed up. For example, this is the descending portion of the colon. They have these different things called colectomies or hemicolectomies. You guys can look these up. I'm not making any of this up. Over here, let's just say this one is completely rotten. It's no longer functioning. So what the doctors do, they start to cut this out. They remove this portion, and then they start to connect this part with this part. They start to plug and play with your small and large intestines. Over here, this colectomy, the tail end of this colon is no longer working, so they remove that section. Now, once they remove that section, you might wonder, well, how is poop going to exit out of the body through here? Well, they're going to put a pouch right here. They put a little hole over here. There's going to be a little hole that is going to be attached to a bag. They remove a portion of the colon, it may be necessary to attach the remaining colon to the outside of the body in a procedure called colectomy, creating a hole, the hole is called a stoma, in the abdominal wall, allows waste to leave the body. So they have to carry this waste back throughout the day and then get that waste material to exit on their own. Over here, this person has the ascending portion of their colon removed. So something happened with this part of the colon. Now, over here, this is where the small intestine is connected. Okay, so coming back to this picture, I just want you guys to learn about the digestive system. This is where the small intestine is connected to the large intestine. And large intestine, this is where feces formation happen, and also it pulls out the water. It pulls out the water. Now over here, they're finding that this ascending portion of the colon is completely messed up. They cut it out. But once again, they're doing some plug and play, right? They said that, okay, this is where the small intestine was connected. Now I'm going to attach the small intestine to this part of the colon. So this is a right hemicolectomy. Now, somebody that removed the whole complete colon out of the body, I'm pretty sure they have to do this procedure. What they do is right now you no longer have the large intestine. So large intestine is completely removed. They start to reshape and repurpose your small intestine. They start to put this type of a pouch, okay, against your anus so you can continue to have bowel movements. But notice that your large intestine actually draws out the water from the feces formation. You're going to have a very tough time. Most people on this, my logic brain tells me they will be on adult diapers for the rest of their life because they just go, okay? They're just going to get to a certain point. They may not even get a feeling they're using the restroom. So that's why they have to wear adult diapers. So I'm just going to go through my social media real quick, making sure everything is all right. If you're on my YouTube, see somebody's on my YouTube, don't be shy. Just put in any questions you may have regarding digestive health, and I'll come back and maybe there's some information that could be helpful on your journey to recovery. Now, over the years, I've just been collecting information, but I've also been applying the information that I've learned. Okay, oftentimes people, they learn a lot of information online or through books, going to different conferences, but most people, they don't do anything with it. It's just information that's in their head. Now, I'm a very practical person. I'm going to show you exactly what I've done over the past 5 years that has completely recovered my digestive health. There are a lot of components that's involved. It takes a lot of consistency. Is it a smooth ride every step of the way? Of course it's not. But what do I want to avoid? I want to avoid this. I want to avoid this. I want to avoid this. And I also want to avoid this. So over here we have a lady in Taiwan. She was only 23 years old, suffering from chronic constipation, discovers her colon severely displaced. I want to just come back to this photo because we're learning here. The colon has that ascending portion followed by the transverse. Over here, it's going to have a slight tilt to the upside before coming back down to the descending portion and out the back for elimination. Looking at the scan of her colon, it is completely over the map. You can see over here, it's coming up to the upside and then it somehow curls back down, kind of like a kink in the hose. Then somehow this hose finds its way back to the upside. And now it's so extended and displaced, it's all the way up in her chest. Then finally, the colon comes back down again and out the back for elimination. The problem with this picture is that this feces formation, it comes down to this kink, and then it has to climb up against this pipe back to the upside. So she's walking around, she's fighting against gravity. This waste material is fighting gravity, trying to get up to this part of the colon, kind of like a roller coaster, you know. That's where all that stagnant trash gets stuck in her colon. I don't know, I did not follow up, don't know what the doctors did. Maybe they had to do some type of procedure to get all the waste material out of the colon. She is quite young. Now, some people, they just wait until it's too late, too old, and the colon is completely hardened, deadened. That's why oftentimes doctors, they have to completely remove it. What other problems are also very common? I'm just reading these. These are different medical websites. I don't have to agree with anything on here. I'm just showing you. When you go to the doctors, they're probably going to repeat the same type of texts because that's what they've been taught. So what is diverculitis? Diverculitis is another gastrointestinal disease. It occurs when pouches called diverticula start to form in the GI tract and become inflamed and affected. This condition commonly occurs in the Western population and can be seen in 10% of people over the age of 40 and 50% over the age of 60. Now, there are millions and millions and millions of people all over the world over 60, and they're saying 50% of them have this condition. The rate of this disease typically increases with age. Scientists believe that this condition is due to not eating enough fibers. Not eating enough fiber leading to constipation, which puts extra pressure on the colon walls, and this causes diverticula or bulges to form the weak areas of the colon. The risk factors for diverculitis may include age over 40, male, overweight, eating a low fiber diet, eating higher fat and red meat, not enough exercise, taking non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, steroids, and opioids, and smoking. Moreover, the signs and symptoms of this condition include pain, tenderness in the left lower side of the abdomen, nausea, vomiting, chills, cramps in the lower abdomen, constipation and diarrhea, and rectal bleeding. Now, taking a quick look at this, when they're saying this lower left side, this is a descending portion of the colon. Something's happening in this area, starting to get these bulges, okay? And doctors, they always tell you that, oh, the reason why you have chronic constipation because you're not eating enough fiber. I just want to challenge that a little bit. If you're chronically constipated, that means you have a lot of waste material that is not exiting out of the body. If you're having that problem, it may not be the best idea to pump your body full of additional waste material in the form of fibers, because you're having a problem with this, and now you're putting more fibers in your system because you haven't gone from this picture on the left to the picture on the right. So it continues to get worse. My grandmother had the same problem. My grandmother at one point, she had chronic constipation, and the doctors always told her, oh, it's because you're not eating enough fiber, you're not eating enough fiber. Well, a lot of people, old people, they take their advice, start eating more fiber, some type of psyllium husk, all that kind of stuff. Did it resolve your constipation? No. How many of you started eating more fiber and on top of fiber, on top of chronic constipation, actually fix your constipation? Leave a comment below. What other problems could happen if you're dealing with chronic constipation? Ulcerative colitis. So over here, ulcerative colitis is a chronic condition that happens when you have inflammation in your colon. Most people would usually experience periods of symptom flare-ups, followed by periods of remission without symptoms. Signs and symptoms include diarrhea, bloody stools, abdominal cramping, and weight loss. Treatments include medication and surgery. My grandfather had this, okay? Couldn't fix it. Did not matter what the doctors were prescribing him, and I had all these memories of my childhood. Just watching my grandfather, he just kept getting weaker and weaker and weaker, and the doctors had no answers for him because his medication stack every single day, his whole table was filled with medications. Now, what do they usually prescribe? They usually prescribe some type of corticosteroids and immunosuppressants or biologics. Now, immunosuppressants are different drugs that suppresses the immune system. So what it does, that reduces your symptom flare-ups. So whatever flare-ups you may have, like diarrhea, bloody stools, abdominal cramping, that kind of goes away temporarily. But have you solved the root of the problem? You haven't, right? So this is just masking these symptoms over time, and while the different problem in the background still persists. Over here, you have something called Crohn's disease. It's another gastrointestinal disease. It's part of the group of conditions called inflammatory bowel diseases. This condition occurs when there is inflammation in the small intestine and colon. The main symptoms of Crohn's disease are diarrhea, stomach aches or cramps, blood in the stool, tiredness or fatigue, and weight loss. It is thought to believe Crohn's disease caused due to genes, a problem in the immune system, smoking, a previous stomach bug, and an abnormal balance of gut bacteria. The risk factors for this condition include family history, smoking, certain medications like antibiotics, birth control pill, non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, and a high-fat diet. So over here you have Crohn's disease, and they are connected, not just having problems in the large intestine, you're having problems in the small and large intestines. But you can see these different symptoms are very common across the board, right? Doesn't matter if you're dealing with Crohn's disease, ulcerative colitis, or you're dealing with some type of diverticulitis, okay? It's the same rectal bleeding, right? It's the same, some type of stomach aches or cramps, tiredness or fatigue, unexplained weight loss. Now, what else can happen if you don't take care of chronic constipation? Rectal prolapse, okay? A lot of people eventually will get this if they don't fix their chronic constipation, because oftentimes they are sitting on the toilet for a very, very long time. I mean, they're just trying to use every strength that they have in their body, trying to squeeze out this material, right? Because they have this urgency to go, kind of like this feeling that, oh, it's almost there. It's almost there, right? So they put a little force into it. And it can drive a person crazy because they can be 45 minutes in, an hour in, and nothing comes out. And as a result of doing that, they're straining on the toilet. The rectum could potentially prolapse over time. It's a complete mess. And I truly believe this could be a root cause of the old people smell. Like old people, they have this really weird smell that they all have. And a lot of old people, they're having problems with their digestive health. They've been sitting on the toilet for a very, very long time. It's their daily struggle. They're trying to just use the bathroom in peace, but they cannot. It's a daily struggle for them. And many of them, not only do they have prolapse, they may get anal fissures. Okay, anal fissures, this just be some breakages, some cracks, or splitting in the anus. It could be very, very painful, very, very uncomfortable. On top of that, you could develop internal and external hemorrhoids. Hemorrhoids or piles. These swollen veins inside your rectum or outside of anus can cause pain, anal itching, and rectal bleeding. Symptoms often improve at home treatments, but on occasion, people need medical procedures. Eating more fiber can help prevent hemorrhoids. No, I disagree. I don't have to agree, what these medical websites say or these medical books. And many of you don't know what a proctologist is. I'm going to tell you what these guys do. And some people, because they have so many problems in the colorectal area, they may be dealing with their prolapse, dealing with anal fissures, dealing with internal and external hemorrhoids. Well, they got people in the medical community, they are called proctologists. They are highly specialized medical doctors who are mostly called colorectal surgeons nowadays. These experts diagnose and treat conditions of the entire gastrointestinal tract, but specifically issues involving the rectum and anus. So these guys, they look at behinds, they look at ass all day. That's what they do. And from doing that, they'll say, okay, you may have this problem, you may have that problem. You may have to offer surgery to get your hemorrhoids removed. We're going to patch up your anal fissure. On top of that, we're going to have somehow tuck in, your prolapse. It's a complete mess. Nobody looks forward to going to see their proctologist. Just like nobody wants to say, hey, I'm going to go see my dentist because you're having a cavity, right? You're having some problems. And then they're going to come down with the drill, and you can hear the sound of that drill all night before. Well, over here, it's even more embarrassing. This is a very private part of your body, right? And I'm just saying, chronic constipation could, okay, be a potential root cause to all these other problems. Toxic megacolon, okay? As a result, now you gotta do colectomies. Chronic constipation could result you with a colon severely displaced. Chronic constipation can make you end up with diverticulitis, okay? Chronic constipation eventually gives you ulcerative colitis. Crohn's disease, rectal prolapse, anal fissures, internal and external hemorrhoids. So today I'm giving you a very, very healthy dose of practical pessimism, and I'm just only getting warmed up, y'all. This is just getting warmed up. So I'm coming back to my YouTube. If you have any questions, type it in. So the best place to find me is probably on YouTube. All right. Next, I want to talk about you want to start to observe other people's pain and struggles way before you even have them yourself. This is a very important exercise for many of you because most people, they always assume that, oh, this could never happen to me. Let me tell you, there are tens and thousands of people on these different Facebook groups, and they are struggling with chronic constipation. They're looking for answers. They've already been to the doctors. They've already been to this and that and the third. But their problems continue to persist. You from the outside, you should be looking in and be like, hey, why don't I take some time and put myself in their shoes? If I don't take care of my 1 or 2 day chronic constipation right now, I'm going to end up just like these people. And these anonymous members, they will simply type with the whole group, sorry to be crude, but there's a big lump of poo that won't come out. What do I do? Okay. Anyone, any ideas? Suffer from constipation now and again, especially when I have been eating crap for the past couple of weeks. I've been constipated. When I go to the toilet, nothing is coming out. Or if it does, it's hard. Also been bloated, especially upper tummy, and like a trapped wind feeling plus since yesterday. Not really got an appetite. Tried Ducales, okay, a lot of different OTC medications stopped working. Never really worked. Eating more healthy and now trying lactulose since Tuesday, but feel like it's just making me fart. LOL. Also to mention, been having some stress and anxiety with family members, been in hospital. What can I do to get my tummy back to normal? Thanks. Consultant has put me on Prucalopride and glycerol suppository. Any reviews? And so people, they stop working with the OTC medication because they stop working, but they're still going to continue to look for gastrointestinal doctors, and they're going to find other prescription strength medications, giving them a try. Had everyone had a horrible couple of days. A lot of wet would come out, and I couldn't push out what was behind it. But after many attempts, making me sore, I finally did go. What I wanted to ask is, do you ever feel queasy to your tummy because of constipation or bowel problems? Sometimes I think it's all the worry and stress the constipation causes. It is not a good place your mind to be in when you're worried about how are you going to use the bathroom tomorrow. A couple months ago, I was looking at the same forum. There was a guy on there, and he was complaining about how he worried that he did not want to eat, because what if he ate and he wasn't able to get the waste sugar out of his body? And that constant stress is the back end of his mind all day, every day. He had very, very dark, negative thoughts, which I will not discuss right now. Over here, has anyone vomited fecal matter because it couldn't go down? What did you need to do about it? Please go to the ER. This is dangerous. So you guys can look up. This could happen. It doesn't happen often, but it is possible. So what happens is that you guys are going to look up feculent vomiting. All right? The vomiting of feces is an unusual symptom associated with gastrocolic fistulas, coprophagy, okay, and violent reverse peristalsis. All right. So just imagine we are dealing with this pipework. Over here, food go down to your mouth, okay, through the small and large intestines. But somehow, if you are chronically constipated, it gets very, very messy. That poop starts to go backwards. You guys, just what I just said right there. That medical paper says something about reverse peristalsis. So all these feces comes back up through this pipe because it can only go two ways. Okay, so if it's not coming out through this hole, what's it going to do? It's going to get all this back up pressure from the large intestine. It's going to push back into the small intestine. Reverse peristalsis, so you throw up something that should have been exited down here. A healthy dose of practical pessimism. I'm going to go through my social media real quick. I'll definitely discuss some solutions with y'all, some at-home remedies, but I want to give you guys background information on all these. And at the end of the day, you still have to find a way that works for you. Okay? It may be a combination of different things. I'm impacted. This is another somebody sharing online. At-home remedies, OTC laxatives, enemas, dietary changes, additions, nutritional oils quit working last month. All of a sudden, the ER couldn't reach it, and their enemas didn't work. The highest dosage of lenses. This is at prescription strength. Does nothing, and the Miralax colonoscopy prep is just giving me overflow diarrhea. Small bits are coming off the impaction, probably from the hospital enemas I got Saturday. What else can I do? I feel like the impaction is just way too big to get out, and it seems like nothing is softening enough. Hello, I've been struggling with severe chronic constipation for a couple of years now, but it's only gotten worse over the last 6 months or so. I've been prescribed Trulance and Linzess, highest doses for both, and neither of these medications are working very well for me at this point. I can pass a little bit of stool, but not much, so I'm constantly extremely backed up. I have to spend about half of my waking hours lying down because I'm so bloated and nauseous and often in pain. Put yourself in their shoes. As far as OTC laxatives, nothing really works there either. Duplex, enemas, suppositories, magnesium citrate, nothing works. I was supposed to have colonoscopy today, but couldn't keep the bowel prep down. The procedure had been rescheduled for a month from now, and one of the nurses at my GI office prescribed a pill-based cleanse. The pill is called Sutab, and I was warned ahead of time that patients often have trouble completely emptying their bowels with this pill. So given my struggle, I'm doubtful that this will actually work for me. Here is my question. Has anyone here gone to the point where nothing works? Meds or OTC laxatives and had to have some sort of in-office medical procedure done? I am so sick and so miserable. What about professional colonics? I'm not even sure how those work. I will discuss about that today. If anyone has any advice or experience with this, I'll be very grateful if you could share them with me, what you ended up doing and what the outcome was like. Thank you. Looking at your digestive system is very similar to the plumbing of your home. Now this is the kitchen sink, and down, this is your garbage disposal. If your garbage disposal is broken, it's malfunctioning, you need to fix it immediately or get someone to do it for you, because all that nasty smell, it's going to invade your whole house. It's going to putrefy, decay, and rot. Another picture of your home, okay, water in, water out, right? So this is the toilet, and how your body functions, it definitely has a mechanical component to this. I want to teach you guys to look at your body with a set of mechanical eyes. If your child is throwing their favorite toys down the toilet, they don't know what they're doing, they flush it, but then you use the bathroom, you try to flush, and now all that poop is overflowing on top of you because it's not going down through this pipe and into the sanitary sewer, you're going to have a problem because that smell, it is going to invade your whole house. And a lot of people, they do have this problem with their body odor. This is no joke. For example, let's just take a quick look at this photo again. If you're chronically constipated, you're stuck with all this fecal matter in your large intestine, unable to get out. And some people, they have this bloated stomach, all that bulging of their bowel. It has a lot to do with this because they're carrying pounds and pounds of fecal matter. Now, when this waste material is not properly exiting the colon just continues to dilate and dilate and dilate, right? Well, all that putrefying material, decaying and rotting, is somehow going to go through the skin. So some people, after they exercise, they sweat, they have a certain smell that is beyond repulsive. Because I had chronic constipation, I'm sure I had that as well. Okay? So I'm very thankful I got rid of my chronic constipation over 5 years now. But I've been very consistent. Now I'm going to get into the part presentation where I'm going to give you some solutions. And you got to continue to do your own research. Even the first one, I haven't done it myself. I just know about it. And I think it could be very helpful for individuals that are out there. But at the end of the day, you have to be your best advocate. And let's just get into it. First one is colon hydrotherapy. Okay? So the colon hydrotherapy works like this. You're laying down here on this apparatus. And the colon hydrotherapist, they're putting in hot water through your back end to help get that waste material to exit out of your back end. So it kind of looks like this. So this hot water is about the same temperature as your body. And they're putting this water in, and they want to somehow loosen up this dead waste material to help it pass through your body. There are many videos online. Educate yourselves. Many TikTok videos, YouTube shorts, different hydro and colonic centers. They're just showing what they do on a daily basis, and you can actually see the waste material that is coming out. And oftentimes you will see more than just waste material coming out. You will see other organisms. I'm not joking. So go look at those videos and I'll discuss about those other organisms. I'm gonna go through my social media real quick. Any questions? All right, I'm going to teach you guys something I've been using over the past 5 years. This is called the self-flush protocol. Now, you may find other recipes online. I've taught this to my own family members. I've taught this to hundreds of other people. There's a very specific way I'll prepare this self-flush solution. There's a very specific way how I drink this solution in a very detailed manner. Because I've tried different self-flush protocols in the past and I failed. And I had to find something that truly worked for me. So these measurements are important. Don't just be haphazard, kind of mixing things randomly in. And how you drink it has to be very specific as well. So let's get into it. First thing you got to do is get yourself some apple cider vinegar. Apple cider vinegar does not have any sugar added. Next, you have lemons, limes, or grapefruit. I've used grapefruits the last couple of years. I think they're the best tasting. And then there's a tiny little bit of sweetness to it, so that it's going to help you put down the self-flush solution. Next, you're going to get yourself some pink salt or food-grade Epsom salt. Okay, so you can use either pink salt or food-grade Epsom salt. Next, this is just black coffee. No cream, no sugar. This is separate from the self-flush solution, and it's completely optional. If you do not want to drink coffee, that's perfectly fine. I'm going to give you the directions for it. So screenshot this, it is important. The night before, you're finishing dinner around 7:30 p.m. If you're not eating any late night snacks, you can still have some liquids, but you're not going to be eating any food. Okay? Next morning when you wake up, it's the same thing. You're not eating any breakfast. And at 11 a.m. on an empty stomach, you're going to put these ingredients into the thermos. So I'm going to go to a slide. You guys can get all the different tools for the self-flush protocol. So these are the ingredients. Okay. And then we have a slide where I show you guys. I need to zoom in, sorry about that. I'm trying to zoom in on this guy. So over here, this is a plastic bottled water, roughly 2 liters in volume, metal mesh strainer. Over here, you have a single press squeezer, most usually to use when you're juicing out these lemons, limes, or grapefruit. Then you have the apple cider vinegar. You have the pink salt or food grade Epsom salt. You have a stainless steel thermos. This is going to have a volume over 1 liter. So, and over here, even the black coffee that I drink, I put it in stainless steel because I don't want anything that can actually break. Okay? You don't want to use anything that can break because we're trying to clean our small and large intestines, and it's going to create an incredible laxative effect. In the process of doing so, you may be rushing to the bathroom and you may be knocking things over, and now you have broken glass on the floor. Don't do that. Some people also make the mistake of, well, I have this other, container, this glass container, it's glass. Well, the problem is that if you're using hot water, which you'd be using, you may get thermal shock, and now this glass also shatters. We want to reduce as much risk as possible. Coming back here, you have these ingredients, and in the stainless steel thermos, this is where you're going to put in. You're going to add 1 tablespoon and 2 teaspoons of pink salt or food grade Epsom salt. In total, you have 25 milliliters of salt. You got to be accurate with this, so the measuring spoons that you got, it has to say the amount of milliliters on those measuring spoons. You're going to cut and squeeze 3 lemons or limes, or use 1 grapefruit. Filter through the metal mesh strainer. You don't want any seeds or any pulp left. You want to make sure this circular product, the solution, as smooth as possible, so when you drink it, it has no obstructions. Next, you're going to add a 1/4 cup, which is about 60 ml apple cider vinegar. Then you're going to add 2.5 cups of hot water. It's about 600 ml. You're going to stir it up. You want to make sure all the salt dissolves evenly in the stainless steel thermos. You can stir it up for 30 to 45 seconds. Then you're going to add another cup, roughly 250 ml of room temperature water. Kind of bring back down the temperature of the sulfurous solution so it's not going to be too hot. Because the sulfur solution, when you first start making it, it's going to be way too hot, so don't drink it right away. Kind of just let it sit. Now, before you start drinking the solution, I want you to get into a very relaxed, meditative state. You can listen to some classical music. I listen to Rachmaninoff, Piano Concerto 2, Movement 2. You can find your favorite classical music or any type of music that's going to help you relax. You want to practice some deep breathing. You can feel your diaphragm or your stomach kind of moving up and down before you start drinking this. The more relaxed you are, the better. Now, this is how I want you to drink it. Very important. You're going to take a tiny sip of the bottled water, hold it in your mouth. Then you're going to take a bigger gulp with the sulfurous solution and drink it down. Then you're going to sip on a little bit of black coffee, completely optional. Now, I'm talking about sipping. I'm telling you, you're not drinking this water. You're just taking a tiny sip, kind of like coat your teeth and also your tongue. And when you drink the sulfurous solution, you can somehow, bypass that taste. Because initially, when you start drinking it, you're not going to like it. If you don't like it, you can also use a stainless steel straw. Okay, that's going to help you put down the sulfurous solution. Then you're going to sip on the black coffee, kind of reward yourself a familiar taste, so you can repeat this process over and over again. So steps 1 through 3, these guys can screenshot this. Your goal is to finish the sulfurous solution first. Oftentimes people make the mistake of they're drinking both the sulfurous solution and the water at the same time. That is incorrect. Do not do that. You want to drink the sulfurous solution. You want to do your best to put it down in your stomach. Because if you were to drink this water together, first of all, that's way too much water. That's going to be 3 liters of water. Going to feel very uncomfortable. and you're taking your time. You can take 45 minutes, you can take an hour, you can take an hour and a half. It doesn't matter. It's not a race. Sometimes people, they drink this too fast and they throw it up. I told them it's not a race. Why are you rushing? And don't make any plans after it. Don't tell your friends you're going to meet them at the park, meet them at the mall. No, don't do any of that. You're just focusing on doing this, drinking it, relax. Okay, sometimes you can even watch your favorite YouTube, TVs, whatever, kind of distract your mind, but you're focused on, I'm going to drink the selfless solution. Once again, you're taking a small sip of this water, holding it in your mouth, taking a bigger gulp of the selfless solution, drinking it down, and sipping on black coffee. The temperature to the selfless solution has a little bit of temperature to it. You can't let it just completely cool down, okay? Now, it's not going to be burning your mouth, but what I want to utilize is the heat from the selfless solution, because hot expands, cold contracts, right? So we're drinking the selfless solution. It has the ability to start to work through your digestive tract. You're drinking it, okay? Maybe there's a better photo to use. So right now, you haven't been eating any food for 15 plus hours. You're starting to drink the solution. It's in your stomach, and just be completely relaxed. If you feel any type of tension, you feel any nausea, like you want to throw up, then do nothing. Just relax and deep breathing until those feelings subside and go away. Eventually, your stomach's going to relax, and it's going to allow the selfless solution to bypass and get into your small intestine to begin cleaning the small intestines first. When you first start drinking this, the stomach doesn't know what it is, so it may be a little bit anxious, but over time, after 3 to 4 times of this, your stomach knows what it is, and it's just routine. Selfless goes into your small intestines, begins to clean it out. Your small intestine is 4.5 meters and has a surface area of a football field. Over years of eating, this thing is completely caked up with trash. Could be filled with microplastics, could be filled with a whole bunch of things that it has a very tough time exiting out of the body. Well, this selfless solution is going to help clean that out, And after you drink the selfless solution, you just relax and keep on deep breathing, okay? You might do some slight stretchings, you may walk around a little bit, and you may have that unction of feeling, oh, I need to go use the restroom, right? Because eventually, the selfless solution is going to work its way into your large intestine. It's been pushing out all this trash, going to push it into your large intestine, and now you're going to feel, oh, there's some type of a movement that's taking place in my large intestine. I want to go use the restroom. So here are the kind of milestones you're going to have, poop milestones. Solids are going to first come out, okay? Now, the first couple times you do this, you're going to be shocked what comes out, because I have never seen like pitch dark poop that come out. I'm talking like it was coming out like charcoal. That's how dark it was, because there's just so much trash that's been accumulating inside the large intestine, had no way of getting out. And over time, you're going to find yourself that, oh, this thing is getting softer and softer and softer. Okay, it's going to transition over to soft poop. And when it gets really, really soft, this is what I want you to do. Over here, you still have plenty of water. This bottled water, okay? You're only taking tiny sips, and then you're drinking the selfless solution, taking a tiny sip with this black coffee. When it transitions to really, really soft poop, I want you to pound this water safely. You're going to drink it, and here's a small little technique. You want to exhale through the nose, so the air comes out through the nose, and drink down the water. You don't want to drink down the water with a whole bunch of air. That's going to cause a lot of bloating in the stomach, a lot of discomfort. Don't do that. You're adding more water pressure to the system so they can continue to flush out more of that dead waste material. So what just happened is you get all this waste material in the small and large intestine that's just exited. The selfless solution that you just drank earlier a couple hours ago, that's also in the toilet. You've been flushing down. And just want to warn you in advance, the smell of it is completely horrendous. As you are pounding on this water, you're going to create a much powerful laxative effect. It's going to be like a diarrhea tsunami. This is not an exaggeration. I do this every week. This is what I've been doing the past 5+ years. And I taught this with my family members, and I taught it to hundreds of other people around the world. Not just in English. I taught it in Chinese, and maybe going forward, I'll get my videos translated into Spanish, dubbed in Spanish. Here's some small little technique. When you're sitting on the toilet, you want to find something, a type of a stool, as long as it's safe, you're not going to trip over it. Because human beings were meant to defecate or have bowel movements in a squatting position. This modern toilet has destroyed many human beings because you're never getting a complete exit of the number 2. Now you can purchase squatty potty, or you can just get a stool, get a cardboard box, works just the same. And an additional technique I can give you is actually lifting of the toilet seat. Lift the toilet seat, because when you're sitting on a toilet seat, it squeezes your butt cheeks. And as you're squeezing your butt cheeks, it's also squeezing the pipe, this pipe right here, right? This is your rectum. And it's squeezing on this rectum, and it's going to have a tough time getting that waste material out. So that's another technique. You can also take this bottle of water into the bathroom with you. As you're drinking this, more is going to come out, more is going to come out, more is going to come out. That's how I resolve chronic constipation. We need to go from the picture on the left to the picture on the right. And it's not just something that you do on a regular, just like once every couple of months. No, I do this every single week. There are only 52 weeks in a year. And I do this every single week. And when I first started, I was doing probably twice a week. I was very, very backed up. So I had to do it twice a week. But now I'm more regular. This is more like maintenance or routine. Your body needs to have consistent maintenance and routine. And just like, hey, you brush your teeth every day, right? Because you're going to get cavities if you don't take good care of your teeth. You got to floss them too. Now you take a shower, right? If you're blessed, right? I'm just saying, like, take the opportunities to do maintenance on your body. If you know other protocols that are very helpful for taking care of chronic constipation, leave them in the comments. I'd love to discuss them with you. After I clean out this pipe, what do? I take some probiotics, because probiotics are very helpful for, digestion. Okay. Now you don't have to buy these probiotics here. I'm just giving you some examples. I use very inexpensive probiotics, and they work for me personally. You have to find ones that are right for you. Predictable bowel movements. Okay, that's what we're looking for. What you eat through your mouth, you must exit out the back as waste material. And keep a really good record of what you've been eating. I think that's a very helpful thing. Have a poop journal. It's like, these are the meals that I've been eating, and these were the times of my bowel movements. Can you get your bowel movements to be that predictable? It's very helpful if you can do that, because then you can have more predictability in your life, and you can schedule things around your schedule, right? Maybe you have some type of event. Maybe you have some fun, go on some vacation, maybe a local trip. You're like, oh, I can expect my bowel movement here, so I'm going to schedule everything up. Or you're going to be going on that trip, and all of a sudden you have to go, right? You have to go. And yeah, so I'm just going to go through my social medias real quick. Just want to make sure people aren't having any pressing questions. So I've been using Twitter, but I'm not sure I've been using it correctly, because there may be some comments, some questions on here that I missed from the past. So I'm just learning along the way, finding what works. So this is a broadcast, but how do people actually leave comments? I don't know. I don't know how it's done. No worries. I'm gonna close down this window. Yeah, we're just getting warmed up. Okay, there's so much more information. I'm just gonna continue to go through. Previously, I was talking about these colonics videos. You guys want to watch them. The more you look at them and understand how they work, right? And you want to be very specific. If you're chronically constipated, you want to communicate very well with your colon hydrotherapist, because it could save your life. And let me tell you what I mean by that. Let's just say you've been chronically constipated, you don't know what to do, and you're not really communicating well with the colon hydrotherapist, and this person makes the mistake of adding way too much water pressure in, okay, too fast. And all of a sudden, your colon dilates too quickly and it starts to get tears or perforations in your colon. Well, now, all this waste material, it is filling your bowel cavity, okay? And your body may freak out. It may go into sepsis shock. And the next thing you know, you're at the ER. So you're like, I may be exaggerating, but I truly think that could be an outcome if you don't really communicate well. And if you're only 1 or 2 days chronically constipated, you are blessed. I think that that's the right time for you to look into these protocols. And now, I am not about enemas. I tried them in the past, failed. Haven't done a colonic myself. I am an expert at this. Using these set of ingredients, something that you drink down, there are limitations to the colonic or colon hydrotherapy because it only cleans out the large intestine. It does not clean the small intestine. You guys see what I mean? So there are limitations to it. And our goal is to produce this laxative effect to blast out that waste material from our behind, okay? Now today I'm going to talk about other problems that most people often overlook. They don't think that they exist. They think that it's just fantasy, okay? I want you guys to really learn about internal parasites because they could cause additional obstruction in your digestive tract. Now I want to share with you guys some content on here that's going to be a little bit more graphic, but it is what it is. So over here, most people think that, well, I live in a first world country. This cannot possibly happen here in my neighborhood. Well, people are finding worms and parasites in their Whole Foods salmon. Whole Foods market. Whole Foods is a more upscale, retail grocery store where people go to Costco. They're finding worms directly in their salmon. Now, there are many different types of parasites. I'm going to go through 4 major ones today. Just getting a little bit of water. Over here, this is the liver fluke. Next we have pinworms. These are tapeworms, and these are roundworms. Of course, there are many other parasites. I just want to go over some major ones that you may encounter in your lifetime. This is the liver fluke. Liver fluke, they first hatch in water, and they always find some type of an intermediary host, such as a snail. They will go inside the snail and grow to a certain size. One thing I want you guys to learn about parasites is that they're very good at doing 2 things. They know how to survive and replicate. They may use one organism, and from that one organism, they will bounce into another organism. From here, it comes out of the snail and may attach itself into some type of watercress, some type of vegetation, and the cow or sheep comes and start to eat this vegetation, and that's how this liver fluke continues to survive. If you talk to anybody in New Zealand, in Australia, anywhere in the world where they have to deal with ranching, cattle business, sheep business, they have to deal with the liver fluke almost every year, because the liver fluke, it attacks the liver. Liver flukes, they know the liver has a lot of nutritional value. It stores vitamins and minerals, and they're going to attack that organ to continue to survive and replicate. It's a very, very big problematic. And as we are eating different types of foods, undercooked meats, okay, undercooked steaks, and that's how we can get it into our body. Right now, people are popularizing eating liver, raw liver, liver king, liver products, and they're just eating these raw things. Now, I hope these guys are actually doing some type of a detox, because if they don't, they may ingest liver flukes. Over here, we have another parasite. This one also first begins in water, okay? And these eggs could be ingested by some type of a worm, and they continue to survive inside this worm. The frog or the fish, they eat the worm. These parasites continue to survive. And I don't know where you live, different parts of the world, they actually eat frogs. They eat frogs here in Taiwan. This is called hot pot, and people are cooking up frogs. Or they eat fish, also hot pot, different dishes. And some of them, they're very, very undercooked meats, because when people get older, sometimes they get very bad teeth, right? They don't want to chew very hard food. So they're kind of just like slightly heating this food very, very lightly. And it's very undercooked meat, and they start to eat it. Well, this particular worm, it attacks your kidneys. And different parasites, they have different preferences. They like to attack different organs. It's very, very problematic. Next, we have a lot of rare steaks, steak tartars. People like to eat at these fancy Michelin restaurants. Sometimes they offer fancy dishes such as this. Let me tell y'all, raw foods, raw dishes, they carry a lot of parasites. Korean barbecue, it's probably one of my favorite. Any type of barbecue, all you can eat. And I eat fast. Anybody that knows me, they know I can eat a lot. I can go to a buffet by myself. I don't need to bring anybody. I can eat there for hours and hours by myself. And that caused a lot of health problems in the past for me. And in Asia, we also eat a lot of intestine products, large intestines, small intestines, different animal parts. Talk to anybody that has to prepare these dishes. They have to clean those intestines daily. They oftentimes will see worms, okay? Because pigs, they're full of worms. Pigs, they can survive on anything. They can eat garbage. They can eat whatever, and they continue to grow. Over here, sushi, sashimi, hot pot, right? Full of worms, full of worms. This is the tapeworm. Tapeworm, they exist in beef, they can exist in pork, in different types of pork products, and these guys are very problematic. Also fish. So these are different species of tapeworms. There's beef tapeworms, there's pork tapeworms, and also fish tapeworms. This is what they look like primarily. This is the rostillum that attaches to your small and large intestines. And these are the suckers that kind of sucks on to the surface of your colon. And so they're very, very firmly planted. Okay? This is their anatomy. I want you guys to study this, because most people don't look into this. They're having these digestive problems across the board. Now, today we cover the waste withdrawal, not exit. Now we're talking about other organisms that could be attacking you right now, causing additional obstruction and inflammation in your digestive tract. Over here, this is the head. These are the suckers, rostillum. This is the neck, and from here, they have a lot of these grids. They're called progonids. These are their reproductive system. The tapeworm is a hermaphrodite, so they reproduce by themselves very, very effectively. So each inside one of these progonids, you may have 100,000 eggs. So let's just say the tapeworm has 1,000 progonids. You multiply that by 100,000. you're dealing with 100 million eggs. And they just continue to release inside of you, right? Causing more inflammation, more problems. Here we have a news article that came out from Thailand. 59 feet long tapeworm removed from Thai man's rectum. Pics go viral. So this tapeworm was coming out of this person's rectum, and it just kept pulling and pulling and pulling and pulling and pulling and pulling. So when we're talking about how long exactly is 59 feet, it's very long. It's roughly 18 meters. Well, how long is 18 meters? We can come back to our handy dandy basketball court, right? From that floor to that basketball rim is 3 meters off the floor. We're dealing with 69 feet of 59. Well, we're dealing with 18 meters. 18 divided by 3 is 6, right? So 1, 2, 3, 4, 5, 6. Just 6 NBA basketball hoops on top of one another. Then that was the length of that one parasite sitting inside their digestive tract. That's all I'm saying, okay? A key term you want to look into is called zoonotic diseases. There are different diseases that can transfer from animals to humans. There are many parasites in your pets, your cat, your dogs. This is a tapeworm getting extracted from this cat. Just like how this guy, somebody was extracting tapeworms from this person's anus. Okay? This person's extracting the tapeworm from this cat. Even the cat is freaked out. Here we have an American bully full of worms. These are Ascaris or roundworms. Over here, this is very likely a botfly. Yeah, the botfly, how they reproduce is crazy. You guys go study the life cycle on that. It's very common in Africa. They can also attack human beings directly. They don't just have to transfer from your animals to you. Different risks that can happen. The raw foods that you're eating, okay? Next, if you're eating raw vegetables, raw watercress, they also carry risk. You may be traveling all around the world. You want to go to the Amazon, do your ayahuasca ceremonies. You want to travel into the jungles of Indonesia. That's perfectly great, but are you prepared? Do you know how to disinfect water in the wild? Do you know how to filter water in the wild? Do you know what to bring? Because a lot of people don't know, so they go to these places and they come back home. They have this problem, that problem, this problem. And they go to the doctors. You're in obvious pain, but they still can't figure out what's wrong with you. Many people have that experience where they're doubled in, they're in so much pain. They might be in the ER, and the ER is like, I don't know what's wrong with you. Isn't that frustrating? Could this be a potential cause to your problem, to your symptoms? Over here, your pet's zoonotic diseases. People are taking Instagram photos with their pets, little children, and these dogs are just looking in their faces. That is a potential risk because dogs may have the potential of carrying many, many different parasites. And some dogs are very dumb, okay? They eat the feces of other dogs. Earlier, we were over here at this slide, okay? And that's what this word means. Coprophagy. Coprophagy. You gotta look up this word. This is basically vomiting of feces. I talked about how there could be obstruction in the large intestines, and now this trash material is backing up in the small intestines, reverse peristalsis. But coprophagy is actually, there are people out there, they eat feces. I kid you not. And that could be another root cause of feculent vomiting. It's a very weird world that we live in, okay? We want to recognize the risks and recognize that, okay, we need to get rid of these monsters sitting inside of us. These are pinworms. Pinworms are also very common. They attack the anus. You can see children, they're scratching their behind. Now, according to PubMed, This is affecting almost 1 billion people worldwide from all socioeconomic classes. Just in the United States, affects 20 to 42 million people with a high prevalence among children. So adults can get them as well, right? And we do have a defense mechanism, all right? Defense mechanism is our white blood cells. We have monocytes, eosinophils, basophils, neutrophils, lymphocytes. They do have the ability to take care of these parasites when they're small, okay? When they're just tiny little larvae, they can recognize them, and neutralize them. Now, what most people are dealing with, they have a weakened immune system. If they're on any type of corticosteroid therapy, which further suppress their immune system, they're basically telling your white blood cells, don't go to work today. And that could be another reason why the parasites thrive inside of you. Now, this photo is absolutely crazy. Once again, this is not Animal Planet. Some people, they're so filled with internal parasites, it's causing obstruction in the colon. These roundworms are being extracted out of a human being. People are having stomach cramps and pain, nausea, unexplained weight gain or loss, swollen lymph nodes, unexplained constipation, diarrhea, persistent gas. In addition to skin conditions such as rashes, eczema, hives, and itching. When you have that many roundworms sitting inside your large intestine, you're going to have a tough time getting this waste material out of your body, because all these roundworms is causing obstruction in your digestive tract. There are a lot of information that is beyond our scope of awareness, and that's what I'm interested in. Nobody has really taught me about the intricacies of the human physiology and also how parasites can cause all these problems in your digestive tract. Over here, I'm going to give you some herbs or different OTC medications that could be helpful in treating internal parasites. And none of this is professional medical advice, diagnosis, or treatment. All right, over here, first one I want to talk about is clove bud. All right, there are different natural remedies that are out there. I want you guys to look them up, and there are many of them. You want to learn about them and see if they're right for you. So you got to work with your doctor, naturopathic doctor, integrated medicine, that they got experience dealing with internal parasites. Here with this wormwood, another product that is very effective against parasites. This is OTC, mebezoidal. Okay, so over here, this will help treating different threadworms. This is also mebezoidal. This is black walnut and wormwood, some type of wormwood combination. This is the tincture form. For your pets, you may look into Panicure C, fembenzoidal. This is a product for your dogs. Also, they have products specifically for your cats. So talk to your vet. And what's crazy is that a lot of vets don't tell you about internal parasites. They prescribe corticosteroids for dogs these days. Okay, because they don't want you to really know the root of their problem. Maybe your dog is having different digestive problems, persistent diarrhea, or maybe they're chronically constipated. And it is painful to see a dog chronically constipated because they keep on spinning in a circle. They get in that squatting position, nothing comes out. Or they're dealing with a whole bunch of skin problems, skin conditions, or losing hair. These conditions could be traced back into something wrong with their digestive tract. It could be parasitic infections that's taking over their body. Have you thought about that? Most people don't look into it. These are more OTC. These are not OTC. These are prescription strength. I think you can get this, without a prescription. But over here, this is definitely prescription strength albendazole. There are so many different parasites in the world. What I shared about today, these are just full-blown organisms. There are parasites, there are protozoans, single-cell protozoans, and they can even cause many other problems. Your body right now could be hosting different species of parasites. Let's just say you got a couple liver flukes in your liver, right? You got some roundworms, eating out your pancreatic cells, or they're just hanging around in your small and large intestines. And then you got some tapeworms hanging around in your large intestine, and you wonder why you have all these consistent, persistent problems regarding your digestive health. That's why I think it's important for you to learn about these different herbal blends, medications, and talking to your doctors how to get rid of internal parasites. Now, you may be watching this presentation and be like, well, I want to get rid of these internal parasites right away. Let me just get these herbs on Amazon. Now, I don't recommend that right away. I want you to learn how you can first clean out this pipework comprehensively. Talking about the large intestines primarily, going from the picture on the left to the picture on the right, getting rid of that waste material comprehensively. A lot of people, they can't figure out how to do this first, and they go ahead and they start taking these different meds. Well, not only are you going to have this waste material sitting in your digestive tract, now you're going to have a whole bunch of dead internal parasites in your body, putrefying in addition to the waste material on top. Can you see why you want to do certain protocols in the right order? The protocols that I've been doing over the last couple of years, first I went from the picture on the left to the picture on the right. Then I had the confidence of, if I were to take these different types of meds or OTC medications for parasites, I know how to flush them out. I know how to flush out the dead parasites. So I've been doing that for many years now, and that has definitely brought me a lot of mental clarity. A lot of these symptoms, even nasal congestions, different aches and pains across your body, they just somehow miraculously dissipate and go away. They're a thing of the past. You're like, I used to struggle with these chronic conditions, chronic problems, and it's kept getting worse and worse and worse, even joint pains. Okay, they could be caused by internal parasites. Just imagine your house is kind of like an Airbnb for all these parasites. They're not even paying rent. They're extracting all the minerals and vitamins, life force away from you. On top of that, they still have to use the bathroom. Have you thought about that? They have to use the bathroom right inside your body. Here we have somebody, they're pulling out roundworms out of their liver. Roundworms has gone so out of pocket, they start to attack different organs, including your liver. I want to go through my social media real quick. Any questions, just put them in the comments. And most people don't look into this, right? Welcome. If you're on my YouTube, just put in any comments. We're talking about digestive health, how you can clean the small and large intestines, getting rid of internal parasites, and that's going to help you recover your digestive health. And today we're only talking very, very surface level. There's so much more. For example, in the future, I can teach you guys how to clean out your gallbladder. A lot of people don't know how to do that. Complete mystery for most. Inside the gallbladder, you may have these things called gallstones. Okay? So over here, a little bit more lessons on human physiology. This is your small intestine. This right here is connected with your stomach. Okay? This is your gallbladder. This is your liver. This is the common bile duct. Inside this gallbladder, you may be stuck with a whole bunch of gallstones. Could be hormonal imbalances, could be parasitic infections. But you don't want to wait until you have a huge problem with your gallbladder where it becomes so dilated with gallstones and you start to experience these sharp pains, gallbladder attacks. Then you're going to have to go to the hospital and they cut this thing out completely. Is that what you want to have? No, you don't. So way before that happens, you want to have the presence of mind. These are risks. I need to resolve right away, and I can't wait until I have all these problems stacked on top of me. Today, we talked a lot of different topics. I gave you a lot of different examples from other people's pain and discomfort, and you want to put yourself in their shoes. Put yourself in their shoes and imagine if I was having these problems, how would I turn the situation around, right? These guys are already telling you, they've already been to the doctors, they've already tried the highest dosages of laxatives, prescription strength, and nothing is working. If you don't fix your chronic constipation, that is only 1 to 2 days. Eventually, it's going to get worse. If you don't look into internal parasites and how you can get rid of them, eventually they're going to multiply inside of you, and you may have to get this surgery where the doctors are pulling out roundworms out of your internal organs one by one. What a mess, right? Or parasites gotten so bad they went outside of your digestive tract and start to attack even your brain. This is called neurocysticercosis. So, who am I? I'm just another regular guy, okay? My name is John. I've been on this health journey for quite some time, over 5 years now. I've helped myself, helped my family members, and also helped hundreds of people around the world. And the first thing that I teach them is the selfless protocol. And I'll leave the link in the comments below. Before, I used to have a lot of digestive problems, even though I was working very hard at the gym. I could not get rid of this belly fat. I always felt very conscious about going to the beaches. This is me in Southern California, hanging out with a bunch of friends, a few friends, downtown San Diego. Now, you can see how these buns were just barely hanging on to dear life. This is me now. I basically have this physique 24/7, 365 throughout the whole year. Okay, this is me again, Southern California. You can see the inflammation around the face. Had a very tough time slimming down. Even though I was working hard at the gym, I had workout programs, I had a personal trainer. Okay, still could not get rid of this belly fat. I was eating right to the best of my ability. What was I missing? I was missing detox. Detox is about getting the waste material out of the body so your body can restore its natural function. It's not about just supplementation on top of supplementation. Most people in the world right now, they're teaching you, oh, you must be missing this. You're missing this vitamin, you're missing this mineral. This is the reason why you're not achieving the results that you're looking for. I used to think like that as well, but right now I'm in the other spectrum. I'm all about, hey, you need to get the waste material out of the body. The body can fix itself, okay? But you gotta know, where are these blockages taking place? It could be unresolved waste material sitting in your colon, could be parasitic activity that is in your small and large intestine. Not only that, you may have parasitic activity in your liver, in your gallbladder, in your pancreas, all over the body. Recognize those. Go to the library. Don't take my word for anything. Go study a month or two on parasitology. Go to some Smithsonian museums where they have parasite exhibitions. Okay, there are also many great videos online about parasites. Go look those up. Go to archive.org. You can find a lot of great books on there. You can also Library of Congress, a lot of excellent books on that website as well. So that's what I've been teaching people, and I've been helping many people, and I want to share with y'all my program, okay? And I've been getting testimonials all around the world in different languages. In Chinese, I've been helping out people here in Taiwan. And right now I've been doing more programs in the English language. So over here, these are all the different testimonials. And it's very funny how they share with me. This one tells me that when they're blasting out their waste material, it's kind of like rockets coming out their back end. So for this person was using the bathroom for about 4 hours. Over here, this person's telling they're losing some weight because their husband was carrying it. They said they lost some weight. And some people trying this recipe online. It's very, very funny. And what do they say over here? Just sharing their experience, okay? So what happens is that you're blasting all this waste material out and the colors become lighter and lighter and lighter. That's how you know it's really cleansing it through. And the water that you're drinking, you're adding the extra water pressure. It just goes from here to the back end very, very quickly. So I love getting these testimonials, okay? And it's very encouraging because this is a very huge health upgrade for many people, okay? And they know that once they start doing this on a regular basis, their body recovers, okay? They have more optimism for the future. They used to get sick all the time, you know? They might get some type of a fever. It comes and goes, basically through the third and fourth quarter. Very, very annoying. But now as they're getting the waste material out, their body is just becoming stronger and stronger. They're making better food choices. It's important for you guys to say, not just thinking about detox. Your body revives. Now, you can't go back eating the same trash foods because your body will begin to reject the trash foods. You can't go back and eat fast foods that you've been eating before. As you're cleaning out the small intestine, it revives and you might start throwing up foods that you shouldn't be eating. You know you should be eating it, but now because you've suppressed that ability for so long, your body wasn't giving you any signals. It's like some people, they smoke, right? When you first started smoking, nobody thought, wow, what a wonderful experience. They were probably hacking things up. They were crying. They were coughing. But after a whole week into it, you're like, hey, I can kind of get used to this. Same thing with our diets. As we've been abusing our body for such a long time, our body stopped giving us any signals. It's like, you know what, you're going to continue to bully me like this? Do whatever you want, you know. As you are cleaning out your body, you start to revive some of these defense mechanisms of your body. It's going to tell you, hey, you need to stop eating this, you need to stop eating that, and you need to go back into a very healthy diet, which consists of foods that doesn't come in a box, okay? And this stuff you already know, okay? Healthy foods, you know what they are. Chickpeas, you know, different vegetables, healthy foods, and you need to go back eating like this, you know. And that's how your body can really start to assimilate the nutrition into your cells, okay? And my health has upgraded tremendously over the last couple of years, and I'm so grateful for this experience. I'm going to leave a link. So go through here, also go through my comments. Somebody's on my YouTube, type in your comments. Don't be shy. Type in questions. Want to go through some more of these testimonials. So sometimes people there are finding themselves slimming down. I know some girls, their size went down, their dress size went down, and they were not even killing themselves at the gym. They just started to do detox and they started to eat healthier. Everything else is pretty much the same. So you should do this to improve your health instead of just thinking, I want to lose weight. You guys know what I'm trying to say? It's like, of course, some people, they always want to market as a weight loss program. But for here, I'm more about getting the waste material out. You're reestablishing your routine, getting that healthy nutrition back into your body. Now, if you're not exercising, I don't want you to go kill yourself at the gym. Just go for walks. on a regular basis. You want to make yourself sweat. If you're taking notes today, there are a couple of things that you must do on a daily basis. Number one, you must urinate. Drinking enough water so you're urinating. Number two, you must have bowel movements, plural, okay? Predictable bowel movements. Number three, you gotta sweat. You gotta sweat somehow, some way. And four, you don't have to eat so many meals if you're trying to lose weight. You don't have to eat breakfast first thing that you get up, okay? I basically eat twice a day. That's it, twice a day. And most people, the mistake that they do is like they haven't done anything first thing when they first wake up and they start eating something. That's a lot of stress in your body. Why don't you go do some exercise, some type of walking first thing in the morning before you eat something? That'll be much better. And when you're eating, you're focusing on nutritional value, right? And that could be different for everybody. You want to find the winning combination for yourself. That's what I'm talking about, okay? I'm going to leave this in the comments below. You guys can get my program. You guys can also connect with me on my Instagram. I also offer one-on-one coaching, so I can deep dive with you, really learn what you're currently experiencing. I may not be the right person to help you with, but at least we can work together and find out if this would be a good thing for you. Because I don't know where you are on your detox journey. Some of you may be experienced with cleaning out the small and large intestines. That's a big check. Some of you may be experienced cleaning out your parasites. That's also another amazing upgrade. But you really don't know how to get the gallstones to be flushed out of your body, out of the gallbladder. I know how to do that. I've been doing that since 2023, since the beginning of last year. Every 2 weeks, I do something called a liver flush protocol as outlined by Andreas Moritz. And through that protocol, it has also upgraded my health tremendously. All these joints, pains and aches, whatever, went away. Hair started growing back. I just have more energy throughout the day in my workouts, deeper sleep. I always love to learn these different things. Now I see myself, my body, just a collection of different organs and how I can upgrade one of these organs one by one, right? And if you are anybody with a mechanical background, you know how to fix cars, fix motorcycles, start thinking of your body parts like motorcycle parts or car parts, okay? Your liver, it works as a filter. It's filtering your blood 24/7, 365. In the human adult body, you have about 1.5 gallons of blood, but it's also going through your body 24/7. I think if I remember correctly, your liver filters about 1,000 liters of blood every 24 hours. So over time, your liver could be congested with a whole bunch of trash. How do you clean this out over time? Not easy, okay? There's going to be some prep work that is involved, some dedication, some persistence, even though there might be some bumps along the road, bumps along on this journey, you're willing to push through, right? Because most people, when they get to the later parts of their life, they have multiple organ failures. That's what they experience. Their blood starts to thicken, becomes more viscous. There are instruments called the blood viscometer that measure the viscosity of your blood. When your blood is not filtering correctly through the liver, through the kidneys, through the spleen, you're going to have all sorts of problems. The whole body becomes very, very stagnant. Okay? It's going to lack oxygen in certain parts of the body, but your body is basically decaying until it shuts it down. It shuts itself down. But you want to catch the early signs of internal organ failure. And if you have any slight discomfort, like slight edemas, swelling of the feet, I'm not talking about you already have major problems with it. If you have slight problems with the feet, some bulging in the feet area, you know you got problems with your liver. your kidneys, something along those lines. Where you have diabetes, then you have hemoglobin glycation, and that thick blood is going to ruin the functioning of your kidneys. Can you guys see everything is connected? I want you guys kind of start to think your body, blood, organs, everything is connected. And how can I improve the conditions of my organs? Getting the waste material out, getting the parasites out, okay? Then improve upon these organs one by one. Getting the gallstones out, okay? Getting the kidney stones flushed out. There are protocols that are out there that talk about, teach about all these different things. And I'm experimenting with the kidney cleanse right now. So later on in the future, I can talk more intelligently about this. How can I improve the conditions of my kidneys? Because I sure do not want to go to a dialysis center. Okay? And what do I got to do? I got to learn about these different herbs, right? And you got to put them in the right amount, in the right order, and using them to the right degree at the right time. And not everyone, it's not for everybody, right? So I'm going to go through my social media again. So what did you guys learn today? I'd like to want to talk to our friend on YouTube. If you're on YouTube, I'm seeing you right now. Just let me know what your thoughts are, any questions you may have. Be happy to answer any questions. So these are for my audience on YouTube. Just give me a holler. You can type them in the comments area. It might be on your right hand side. If you're on desktop, it might be in a box. Well, thanks so much for everyone for jumping on this call. Okay, once again, my name is John. None of this professional medical advice, diagnosis, or treatment. I'm going to leave a link to my programs in the comments below. Check them out. You can also work with me one-on-one. Just DM me on my Instagram, which I'll also leave the link in the comments below. Have an amazing rest of your week.